If you have pain with you know what, should you use vaginal dilators to treat it? So vaginal dilators, or sometimes called vaginal trainers, are these cylindrical devices that go up in size. Usually like a silicone, sometimes a plastic, and they are usually the go-to treatment for issues like vaginismus, vestibulodynia, any sort of pain with insertion. I get asked all the time, like, hey, I have this issue. I was recommended dilators. Should I use those? And my short answer is yes. Dilators can be a really great option for treating these types of conditions, but my long answer is there are a couple of caveats. One is that while dilators are generally fairly effective at treating these types of issues, especially like vaginismus, they are more effective when they're done with the guidance of a physical therapist. So while they can still be effective when somebody does it on their own, it's generally a little less effective, and a lot of people give up really quickly. They don't know how to progress it, they don't know what it should feel like, so they try it for a little bit and then they stick it in their closet and they never try it again. But it can have really, really good results if you're doing it with therapist guidance. Number two is that it should not be treated like a checklist. So a lot of people want to use the dilators like, okay, I can insert that one, check, move up to the next size. Okay, I can insert that one, check, next size. Okay, let's just get it in there, like check. And that is not really how dilators work. They are not really a physical stretching tool necessarily. They are more of a nervous system training tool. And that can take some time, and it sometimes requires some fluidity. You might go up a size, you might go down a size, you might use multiple sizes in the same session. You might have a really good week and then you might have not so good of a week. Trying to use it like a checklist, like I'm done with that one, I'm done with that one. Oh no, why does this one not work today when it worked yesterday? That can create a lot of burnout, and again, people just wanting to give up on it really quickly. The goal is not to push through pain to get the dilator in. The goal is to work with your body to create more of a sense of safety and comfort when you're using the dilators and when you're inserting something. And one other thing to keep in mind is that if your brain doesn't feel safe, your body's not going to feel safe. So you can do all of the dilator training that you want to do, but if you are not in a situation where you feel safe and comfortable with your partner, you don't feel like you can trust them, then your body is still not going to want to respond the way that you want it to, even if you do dilators and it's successful for you. You have to get your brain on board with the process, and that might require some sort of couples therapy, that might require some sort of trauma-based therapy for yourself, etc.